Breakout sessions. Thank you for taking the time this afternoon to be with us. This is on Indigenous Health Innovation. My name is Dr. Jessica Hogan. I'm Assistant Teaching Professor in the College of Health Solutions. It's an honor to be here helping to moderate this session today. We have with us Ms. Cherry Yamane, PhD student from the University of North Dakota, as well as Jared Duval, Dr. Jared Duval, yes, is that correct? Okay, and you're also coming from assistant professor at NAU, thank you. And so today is going to be a little bit different. We are going to have Cherry present on some of her information, and then we are going to make this a little bit interactive. And so it's a little bit different from what we would normally experience in the traditional conference setting. So I want them to introduce themselves as well and tell us a little bit more about yourself and your research and your background.
Aloha mai kākou o Cherry ko inoa no nanakuli mai auka hi kaulani I ka pu'u hele akala. O ka ua ula lana ka inoa o ka ua, o ka makani ka ulu ka inoa o ka makani, o oia lawa lako ka umau papani. So aloha everybody, I am Cherry. I am Kanaka, Y.E.W, so Native Hawaiian from Oahu, Hawaii. My winds are Ulalena, and my makani or my wind is Kaiaulu, and my rains are Ulalena. And where I am from, it is known for where Maui caught the sun, although we will fight all of my other Pacifica cousins who also say that Maui caught the sun on their islands. But let's be real, Waianae is hot, so it just makes the most sense. I am a second-year PhD student at the University of North Dakota in the Indigenous Health program and the School of Medicine and Health Sciences, and I am also the founder and principal consultant of Land-Based Healing, LLC, and a lot of my work is centered around just being a resource to my community, and that's basically it. So a lot of the times I do help my community either with research, evaluation, programmatic development, centered around community-based and culturally driven approaches, which is what I'll be talking a little bit more about today. Thank you.
I'll just briefly say hi, my name is Jared Duval. I'm an assistant professor in the School of Informatics, Computing, and Cyber Systems at NAU, and I'll give you a little bit more information when this talk is over.
Thank you. Hi everyone, my presentation today is going to be on indigenizing research through culturally centered policy innovation and community collaborations through indigenous culture as health approaches. So just for agenda, we're gonna go a little bit over the, a little overview of Native Hawaiian and Pacific Islander health, although I won't focus too much on that because we do know that, there's been a lot of history around deficit and disparities focused research, so that is not the point of this. It is more to highlight the overview of community-based and culturally grounded programs that I've spent doing over the last decade in my work, and what Indigenous futurities would look like. So I gave an introduction of who I am, but that is the mountain that I come from, and this is 5 generations of my family. So there's my great-great-grandmother, my great-grandfather, and me as a little dinosaur. And then my great-grandmother, my great-grandparents raised me, along with my parents, all pictured here. And then there's my sister. We don't look alike in the little bottom corner photo. But I bring my family and my community with me in everything that I do. So I felt that it was important to share a little bit about myself personally, as I share in this space with all of you as well. And so just to go briefly, we'll go over this real quick, but this is the health status of Native Hawaiians and Pacific Islanders. And so what we know about Native Hawaiians and Pacific Islander mental health and substance use, it is the leading cause of death for our youth. And this is a result of increased discrimination against our people, especially when accessing care, which is why there is no access to care. And it just exacerbated over the COVID-19 pandemic, where a lot of Native Hawaiian youth especially experience 43% of sadness, depression, starting at the age of 10. And regarding substance use, there's more use, earlier use, and more drug offers than any other community or population within Hawaii. And also, like, it's not just limited access to healthcare, it's literally, it's also like compounded with the systemic level issues, and in addition to barriers to seeking help because of the lack of cultural appropriateness and cultural humility when providing care and services to Native Hawaiians and Pacific Islanders in Hawaii, which you'd think it would make sense, right? It's Hawaii. You'd think that the care would reflect our communities, but it really doesn't. And so this is just like a little bit of an adaptation of Dr. Karina Walter's stress coping paradigm, because those health outcomes that we see today are really a reflection of the impacts of colonization on our communities. And this is a result of the early arrivals of missionaries in the late 1700s, the genocide and the introduction of diseases amongst our people, as well as the illegal overthrow of the Hawaiian kingdom, which imprisoned our queen, which is our last reigning monarch of Hawaii. And we are not part of the United States. We are illegally occupied by the United States. And we just celebrated La Ku'oko'a at the end of November, which was our Independence Day, where we were recognized as a sovereign nation. So US's occupation of the Hawaiian Kingdom is in fact a violation of international law. And as a result of their occupation of our community, we have experienced a plethora of epistemicide, cultural genocide, language elimination, as well as some other assimilation practices, which have disrupted our cultural ways of being. And as a result, is the reason why we experience the health outcomes. And what this is trying to do with this presentation, and like the work that we do, or I do with my community, is we're trying to use our culture as a coping strategy to mitigate and reduce a lot of those health outcomes that we see today. And so I'm just gonna go a little bit over some community-based and culturally driven health promotion, both with previous studies that I've worked on in my earlier career, as well as like what I'm working on now with existing programs. And I was previously employed at the John A. Burns School of Medicine in the Department of Psychiatry, working on 2 substance use prevention programs for Native Hawaiian youth. Ho'onopono, it's actually partnered here with Arizona State University, but Ho'onopono is a curriculum that was developed in Hawaii Island and with the DOE systems, and then what they had done was understand both the Native Hawaiian context, but also the local context of Hawaii because of the huge diverse population. And so we have like this intermingling of culture that happened way back during the plantation days, but we won't go into that, although I do recommend reading the book People and Cultures of Hawaii by Dr. Naleen Andrade, which kind of gives people a better understanding of who the people are from Hawaii and who Native Hawaiians are as well. But within that curriculum, it included cultural vignettes, it was school-based, and it was adapted to fit the context of Hawaii. Whereas Puni Keola, this is truly a community-driven intervention program that was situated in Molokai that focused on sacred sites and situated within a local fish pond. And it was developed by the community, and it was led by traditional cultural practitioners, and Kia'i local are stewards of the fish ponds, where the kids could cultivate and learn about the traditional practices of our fish ponds. And during long discussions with my supervisor, Dr. Susanna Helm at the time, we were like, okay, Ho'onopono gets a lot of funding, they get a lot more access to services and can have a huge impact. But Puni Keola, there's something different about it. And the difference was we were actually practicing our culture, and we were reclaiming, and it wasn't adapted in any way. It was just a space where kids can engage in who they are and with our traditional teachings. And we were like, but how do we contextualize this? How do we even explain this to funders? Because we couldn't get a lot of funding for Puni Keola. And we couldn't get a lot of support or resources from the state for something like Puni Keola. And so what we did was we were looking at this culturally informed practices curriculum that was developed by Dr. Scott Okamoto, who's actually the PI of Ho'onopono, where he talked about along this continuum of cultural intervention practices, there's the dominant culture, which is Eurocentric in nature. And along that continuum, there's the process of adaptation. Sometimes those adaptations within cultural interventions is just shoving on a Hawaiian word and saying, this is a Hawaiian intervention. But we're not doing that. We're like, oh no, because that wasn't built for us. It wasn't built with us in mind. And so culturally grounded, like Ho'onopono falls within that because like our values are heavily embedded within that school-based curriculum. But we're like, Punikiola is along this continuum where we're explicitly privileging that culture, but we didn't necessarily have the words until I conducted a lit review, like anybody else would. If you're taught Indigenous research, that's just kind of where you got to start. So we looked at PubMed Central. This was actually during my undergrad, where I looked at PubMed Central, looking at these Indigenous population identifiers, and as well as like culture as it relates to different levels of prevention. And then from that, there was 908 articles that populated, kind of winnowed it down, and then there was 6 articles where people were actively engaging and practicing their culture. And there was 6 that was more in the developmental concepts of like, it was more in the development phase rather than the implementation. So we retained that just to kind of understand like, how are people utilizing and explaining their culture within interventions? So we can figure out a way to explain, what does this look like for communities? And what does this look like as an opportunity for cultural preservation and perpetuation with Indigenous communities? And so from those 12 articles, this is just a brief 2 articles that popped up. Obviously, Punikiola popped up as one of them, that talked about like culturally immersed practices led by cultural practitioners using photo voice, and the kids got to learn like the traditions of that sacred pond that's been around even before colonization and before contact. And then one that's more popular and also a really cool study is the Kohola Project, where it looked at coronary arterial disease and utilized hula, the practices of hula, oli, our sacred chants, and all of this taught by our kumu as a way of reducing blood pressure. But the reason why I highlighted these 2 articles specifically is because one is situated. I wanted to talk about place, sacred sites, and land-based, because they all intersect in the way that we engage within interventions. Punikiola is in a sacred site, whereas the Kohola Project was something that kind of, like, we called it a transitory space, because when we enter a space and you engage in it intentionally, that then becomes sacred. And we thought that this was something that was super important to talk about Indigenous communities who have been removed from their lands, who have been displaced as a result of colonization, or like for Native Hawaiians and Pacific Islander, gentrification, or environmental injustices. So what does it mean to engage in your culture in a place that's not originally yours? And so that intention of being in the space is creating that sacredness around that. And so this is how we came about with Indigenous culture as health, where we are explicitly privileging our culture, where our culture is intact. And it may look different for every community depending on what that culture looks like, but it is the intentional action of preserving, perpetuating, and honoring our ancestral legacies. And it took me forever to publish this, okay? So like it came out 2 years ago. Like every other person who leaves like all their unwritten things on a desk for 5 years. But yeah, so like along with that continuum, this is what we kind of found throughout all of the articles that emerged, was culturally grounded interventions encompasses Indigenous ways of knowing, where it's intergenerational knowledge transmission, so knowledge that's passed down from our ancestors and our elders. But as you like engage with your culture, like it's active engagement through cultural practices. It is active participation. It is an active way of being. And it's situated either in a place or a sacred site. So it's either a fixed physical location or a place that becomes sacred when engaging in it. And then, excuse me. But Indigenous spirituality was something that encompassed all of these things, and I don't think that's talked about enough in Indigenous literature. But it is the foundation to all these things, and I think we should make it a little bit more explicit in in the way that we talk about our cultural practices and knowledges. And it just gives meaning to all things, and it respects all forms of religion and spirituality as it was deemed appropriate by all of the literature and articles that popped up in this specific literature review. And so we use this model to kind of inform like what does it look like in research and programs? And one of my community partners, so this is during my master's degree. So one of my community partners reached out to me. They're like, we like what you do over there on Molokai and Big Island, but why aren't you working in your own community? And I was like, because I don't really go out and do research to do research. I kind of get asked to do research and evaluation, and that's the point of being a resource to my community. I don't just decide one day I'm like, I gotta study this. I just kind of sit around and wait. And I kind of like being in that position. But they're like, we want to look at culturally informed practices, specifically as it relates to connection and identity. Sorry, I'm taking way too long. But so we built it off of my article, and then my prior colleague, Dr. Rachel Burridge, who also did a scoping review on Indigenous cultural interventions. And we looked at, like, what are they looking at when they're looking at this? Like, are they looking at ethnocultural identity? What does it mean to look at the land? What does it mean to look at in the environment within engaging in cultural interventions? And how does that reflect pride, sense of self, sense of being, and all of these psychosocial metrics of positive attributes that people have? So we did another lit review because we found out we still knew nothing, or we needed to know more. So we did another lit review. I didn't publish this. Look, it'll come out in like 3 years from now. We got to count 5 years every time I do something. But we looked at, like, specifically Indigenous population identifiers as related to the Pacific, and then looked at cultural interventions, building off of the terminology that was used both in my review and then Dr. Burridge's review, and then looking at, like, those positive psychosocial attributes of sense of place, sense of self, pride in community. And then from this, we found another 163 articles that popped up, 10 of which met the inclusion criteria. And what we found was that the importance of community, because relationships, I mean, this is kind of obvious though, so I don't, it's kind of obvious, but whatever, we had to make it scientific so that funders and everybody else can understand what the heck we're doing. But we talked about connection and value to the land as it relates to community, and then having that collective strength and place for family and communities to thrive. And then when they talked about culture, it's not just culture, like traditional culture, it's also about lived experiences and the maintenance of that cultural practices and ways of being and ways of knowing. So it just kind of like further emphasized what was found in like my initial literature review. And then when we looked at identity, we talked about like that increased connection and knowledges of the home and increased connection to knowledge in self. So the more people knew about their heritage and their culture, the more it influenced who they were and how proud they were to be an Indigenous person of their community. And we encompassed all of this within this process of connectedness or reconnectedness. But I also argue that everybody is connected. I think we're all connected. It's just sometimes like we gotta feel that fire that kind of calls us to our ancestral teachings, because you're grounded in your ancestry. And I think that's my soapbox on connectedness. I don't think anybody can tell you you're not connected. You kind of are, your ancestors know you. But anyway, so this is just one other article. So this one was a study that was done with Māori populations, looking at therapeutic environmental, culturally appropriate construction. And when they talked about community, they talked about kinship, family, and the land or placenta. So what does whenua mean? Like your ancestry is connected to community. And when they talked about culture, they talked about ways of knowing related to the environment and lands, the embodiment of cultural practices, understanding of place, and cultural meanings of that place. And when they talked about identity, they talked about that sense of self in all relations to to their family, to the land, that sense of belonging, and identity related to responsibility, because we are responsible to the land as the land is to ourselves, and we're responsible to each other as relatives. And so this actually ended up informing a community needs assessment, because we're like, well, we got our lit review, we kind of know what we're looking at from this literature review. We want to know that, like, we want to have it centered around community, identity, and pride, and all of that. So we actually interviewed 12 people from my community, and that was 230 pages worth of transcripts that I had to do in 1 year for my master's. I don't know how I survived that. And the people who informed this, they were of all ages. So we had Makua, like our early age Makua status, and then like our kupuna, so our elder status, all contributing to this. community needs assessment to help us identify how we're going to build a community that was like truly centered around our ike or our knowledges. And so this is just one thing. So we asked our community 4 questions from this literature review. We asked, what does it mean to be from Y.E.W? To situate, what does it mean to be from the place you're from? How does it make you feel? What are some concerns you see in our community? And if you had a magic wand, what would the solutions be? And one of the community defined solutions, somebody said, so my vision, the marae, or the sacred place, is to provide a safe place for them to learn that they can call home and allow them to create that home environment there. So that's the lo'i system, yeah? That's the bringing everybody together, work together, and so forth. Laulima, all of the values, but most importantly, if we really want our people to heal, is that they gotta understand and learn their Hawaiian values, not this aloha and all that, but really understanding aloha, where you have ho'i ho'i, which means to return. The more love you give, the more love the person given to you, you know, the exchange of love. And this was something that meant a lot for our community, is to create that space of love. And then when we talked about like, what does it mean to be from Y.E.W, somebody said, one of our participants stated, my connection to Y.E.W. So, you know, growing up over here, watching the sun rise and fall every day, seeing the same mountains every day, just kind of build this pride in seeing your home. Little by little, learning more and more about my genealogy, more and more how connected I am to the Y.E.W coast, like understanding that my family goes back 400 years in Y.E.W. So this is kind of home, genealogically, yeah. And just in these discussions, we developed this concept model of community connectedness, cultural connectedness, the identified concerns, and community-defined solutions. But I have 2 minutes, so I gotta click on. So, and working with psychologists within the behavioral health department, we identified these clinical research evaluation tools, but also wanted to develop our own community-driven approach based off of that. So we incorporated questions, which also is not published. We developed a Hawaiian cultural connectedness scale, looking at ancestry, the lands, community, spirituality, and traditional knowledges. And that will be at some point done with my dissertation now. But from that, we developed an 8-week program called Kamana'i Local. So they were taught traditional bark cloth making, traditional weaving, learning about their genealogy, the stories of our lands, as well as hula and oli, like the chants of our community, just to kind of center around the land and who they are and who they're from, and gathered all of that data. And with the same essence, I also got called to another project called the Menehune Film Academy. So I'm talking about 2 projects now. This is another one that was developed back home to use community-based and culturally driven digital storytelling for Native Hawaiian youth mental health. And this one is centered around the ocean-based and our ocean teachings. This one's not research, actually. This one's a program. And I think that it's important to recognize program evaluation too, because it doesn't always have the same stage that research does. And it's developed by Pake in the picture, who is like such a beautiful person, internationally recognized filmmaker, professional surfer, and just a beautiful person in my community who I have the privilege of working with. And so far, we've been doing very grassroots things, like developing the very first Y.E.W Film Festival, which just happened a couple weeks ago, where the kids get to share their stories and what it means to be from Y.E.W. And the Wayfinders program, we're working on developing digital storytelling curricula and hopefully getting funding for a Global Indigenous Youth Film Exchange Program for the Pacific, where youth can share who they are as Kanaka and as Pacifica youth, using arts-based qualitative storytelling and methods. And again, it was all centered on this model, which is why I keep getting called to do things. And I'm like, yes, please call me. I love doing data, not the grants though. And then I guess like the vision going forward when we're looking at like these types of programs, and I can like name lots, is when we're thinking about community-based programs, like it really does take a lot of time, a lot of resources, a lot of relationship building. Like I said, I didn't go out and seek research. Research and evaluation came to me because of the relationships that I have with my community. It takes a lot of funding. Also, sometimes we worked for free because we couldn't get funding because funders don't recognize cultural interventions that are intact. They don't recognize us just being thriving Indigenous people. Yet. That's why we're making it all scientific, so hopefully we're speaking their terms so that they can understand ours. And also just encouraging communities to think about like what meaningful community-driven data is. That's why we started to use our own scales, because we found out that the scales were inadequate for like the true meaning of that pilina or that connection that we have to the land. And then as far as policies, like there's like a whole bunch of policies. They just gotta like recognize that we're doing cool things out in our communities. Like the White House memorandum on TK and federal decision making, while that one's employed primarily for environmental health, you know, like land-based healing is environmental, and it's also holistic in the way that we approach it. All of this other stuff. Anyways, we're like, we just gotta tell policymakers it's about time to just let Indigenous people just do our thing. And we'll leave the questions, but thank you.
Thank you so much for that, Cherry. Now, Dr. Jared Duval is going to do a more hands-on activity. I'll let him introduce the activity, and you will see that there are certain, little boxes on these tables up front. So we are going to stretch our legs. We are going to move, kind of get off our devices for a moment and be as interactive and engaged as possible. All right, thank you. Take it away.
Thank you. Hi, everyone. Jared Duval. Here with my postdoc, Tochukwu Aikun, if you could wave at everyone. And so I have a few slides to just briefly add some context. Do I hit the red one or the green? Oh, there we go. Okay, so I'm here representing the Playful Health Technology Lab at NAU, and I created this lab because I have maybe the radical idea that play is the absolute most important thing we can do with our lives. I believe that there's nothing better to educate us, to heal us, to connect us, to enculturate us. It is the reason we're here. And so hopefully you agree with me to some degree on how important play is. And so to do this, and to research this, and to science this, we use a fundamentally different kind of research, which is called research through design. And basically, it's the essence of learning through doing. It's very iterative. You try things out, and you use your hands a lot. And so one example that I can give from some of our most recent work is we're using games to motivate people to transparently go out into nature, into different times and different space, and collect internet measurements. And how can we make this process of collecting internet measurements and broadband more fun? And by doing that, we can create these more accurate, crowdsourced internet maps, so we can tell policymakers, hey, this is where the gaps are. You should invest internet infrastructure here. So that's one of our most recent projects. And so the one that I want to talk to you all about is a recently funded project from the NIH about how we can use games and play to address hypertension among Indigenous communities, and doing so through a non-deficit-based way, and play is a really apt way to do that. And so we've done a bit of homework before coming here. So we participated in a community engagement studio with the Southwest Health Equity Research Center, and we had 5 community partners working with us on that. We're working with Dr. Kirby in Northern Arizona Healthcare, who's done a lot of preliminary work on access needs related to hypertension. We've gotten our tribal consultation, we've done our IRB. Tochukwu led the NSF I-Core MedTech program, where we interviewed 20 people, mostly healthcare providers for that one. And we've done some workshops on how to get science out of the lab. And so through all of that, we came up with these 8 requirements that are leading this project. And this project still is in its very early stages. So it needs to be a telehealth thing, so that way people with phones can participate. They're pretty ubiquitous. It needs to be able to be offline for those without internet. It needs to be a social game that promotes intergenerational connections. So there might be an elder that has hypertension, but the whole family is part of that. It needs to bridge what's happening in the clinic and what's happening at home. It needs to be a bunch of little short mini games for modularity, so you can pick them up and put them down and play what is most interesting to you. It needs to gather intelligent data that helps us learn more about how to improve these outcomes. And it needs to celebrate the mundane, everyday practices that lead to sustainable, healthy habits, which is the hardest part of improving hypertension outcomes, because it's slow. So we also made sure that there isn't another thing out there that's already doing this. We envision this thing as a intergenerational, familial game that focuses on all of these factors that we've identified. And so we're going to create these bite-sized mini games that each focus on an individual factor, and it's going to collect interesting data for researchers, clinicians, and there should be an arrow that points back into the Navajo family. So we've got a long road ahead of us, but today we're going to talk very briefly about the cultural probe protocol that's happening now. And for the Dene people in the room, please ignore the errors in the Dene Bazad translations for this cultural probe, where it's currently in experts' hands for better translation. And so a cultural probe is basically this workbook for 7 days that we're asking people to bring home into their families, into the context, so we can learn more about hypertension from their perspective. So the first is, what's going well about hypertension? What are the barriers, is day 2. Tell us what you're eating. What was the healthiest thing you ate today? Tell us what you did for your physical wellness. Play this game that tests your knowledge, and we're also using that as a data collection mechanism to see where the gaps in knowledge are. And then we're asking them to make a game, and we're going to ask you to do that in just a moment. So we're skipping ahead to asking you all to make a game with us. And so to give you an overview of what we'd like to do with our remaining 15 minutes or so is we'd like you to choose one of these factors that we've identified, and I challenge you to choose the one that you think is the hardest to solve. So is it exercising every day that's the hardest? Is it remembering to take your medication every day that's the hardest? And then once we all are sitting at these spots in the front with all of the factors, we'll have you really quickly just jot down unjudgmentally all of the ideas that come to mind that are playful. And then after you write them out, we're going to have you choose one and make a visual of it. And then you're going to share it amongst your table for 5 minutes, so you'll have 1 minute to present your idea. And while you're doing that, everyone is going to jot down on Post-it notes what they think is awesome about your idea. What are the strengths? And they're going to stick it to your idea. And then we'll only probably have time to hear one idea from each of the tables. So that's the plan. We're hoping to use this as a research project. We'd love to include this data to show our process of coming to fruition. So it's totally optional, but if you'd like, there are consent forms on the tables, and you can fill out the sign-in sheet, and anyone who does that will be entered into a raffle for $100. You have a 1 in 10 chance to win. So there's probably 2 people in here that'll get $100. All right, so let's start. So if everyone could move up to the front and choose the factor that they're most interested in. If you don't want your picture taken or your data included, just wave me or Tachuku away from pictures. Yeah, and we'd love to see representation at each table. Yes, please, play. So over here is the exercise table. This is the education table. This is the blood pressure measurement table. diet, nutrition, and then medication adherence. All right, so whenever you're ready, go ahead and have a seat and we'll jump right in. Again, if you want your anything included in any of the publications we'd like to do, just fill out that consent form and that table that's on the table. All right. So the first thing we'd like you to do is just brainstorm fun, creative, playful, gameful ways that you might motivate people to work on for their hypertension within the factor on your table. So we have some tips here. Write as quickly as you can. Right now, suspend your judgment. Write as many ideas. Quantity is better than quality. And you can suspend all disbelief. We can be in Star Trek futuristic land. We're in a perfect utopia where all resources are available to you. And so you'll have 3 minutes to do this. And if you need help, these prompts up on the right might help you think through how you might design that game. So design is often better when you do it really fast. I know it's a lot, but also we're a little low on time. So step 3, we want you to actually try to take one of your ideas and bring it to the next step, which is a super low fidelity prototype. Again, no judgment of your artistic abilities or anything like that. But we're gonna ask you, instead of like using words, try to describe your idea visually in some way. So you can create a little storyboard of characters playing the game. You can mock up what an app might look like. Really, however you intuitively represent your idea visually is great. Through here, but we only have a few minutes left in the room. So I've heard a lot of this happening already. It's been wonderful to kind of eavesdrop. But for this next step, what I'd like everyone to do is just share their idea with everyone at the table. And while ideas are being shared individually, use a Post-it note to just jot down what you think is great about that idea, and then we're going to stick them to that person's ideas. We are hoping to take all of your inspiring ideas and incorporate them into the final game. And we want to document that progress and share it as an example in our future publications. So if you're, again, no pressure, but if you're interested in helping us do that, there's a demographic table that you can fill out and a consent form on the table that you can sign for us. We won't include any data that you don't want us to include. All right, so let's move to our final step, which is the share out. And so what we're hoping to do is just hear one idea from each table in 60 seconds or less for each idea. And maybe someone else can share someone else's idea, right? So don't share your own idea, share one of your table mates' ideas. So does anyone want to get started?
Hello, we have the exercise table, and this sounds really weird. And so one of us came up with the idea of being chased by zombies and this alternative reality, and that if we were actually being chased by zombies, we would get up off of our butts and start moving instead of going, oh, I got to get on the treadmill. This sounds laborious and I don't want to do it. But if we were in a game and we had to run and we were actually, had somebody on our tail, then we would, move more quickly.
Maybe we can make technology that has like zombie breath breathing.
Yes, much more realistic.
Thank you. Who wants to go next?
So we had the measurement, which is blood pressure, taking your blood pressure and trying to get people to take their blood pressure more regularly. So we thought of sort of a nature game where for every day you take your blood pressure measurement, it starts with a tree and it starts to bloom, and then the nature around the scene just sort of continues to expand if you continue to take your blood pressure on a regular basis. If it's too high, maybe things start to get a little dry on the tree and they kind of wilt a little bit or whatever, but that we could, you know, integrate water or animals or anything else and just have the nature scene kind of expand. And we thought also it's kind of a calming effect as well to have, you know, that kind of a game.
Yeah, that's beautiful. Thank you. Does one of the other three tables want to share?
We didn't exactly follow the directions quite right. We developed a game idea collaboratively, all together through discussion. We had medication, and you know, the challenge of remembering to take a medication, but sometimes a reminder is kind of annoying. So we kind of thought of like a competition, like the first person who takes the medication in the morning, like gets first place, and you know, so on and so forth through like your group of friends or family that are, you know, all together and participating. And then that tallies up at the end of the week. So you can have a weekly winner, like the person who was consistently first, right? And that, you know, for some folks they're competitive. So maybe, you know, the kid is having fun, or, you know, like probably a grown-up kid on blood pressure medication, but you know, they're like, I won, you know, or the sister or the brother, right? You know. And then maybe at the end of the month, you could have like a monthly winner or something. They get a trophy, and then maybe it resets that month. So, you know, it's not always cumulative, because that can be maybe discouraging at some point for people. They kind of get a new start to be first that month. And you get bonus points for refilling on time.
Awesome. Okay, so I think people are starting to come back in because the session is over. I just want to say thank you so much, and if you want to make more play with the PhD lab at NAU, please collaborate. And then if you could, anything you want us to have for the publication and data collection, if you could just put it in a pile in your table, and we'll only collect what's in that pile. All right. Thanks, everyone.
Okay, so a big round of applause for our presenters today, for Cherry and for Jared. Thank you so much for your creativity and for your innovation and for your contributions to health within Indigenous populations. We appreciate you so much. Thank you for traveling here, and we wish you the best and all the success on your future endeavors. So thank you again.